Kia ora, thank you. The tragedy of the measles epidemic sweeping the Pacific at the moment is multifaceted and complex, but I'd like to hear from the panellists to what extent you think governments should act when it comes to the spread of incredibly harmful misinformation such as the anti-vaccination movement on social media.
Yeah, Virasila, I'll start with you on this and move to Alex, because we want to hear what Australia might be able to do about this. Go ahead.
Sorry, what was the question again?
It's the measles epidemic, which has killed 44 children in Samoa, and the question of anti-vax campaigners being partly responsible.
Yeah, I mean, it is a real challenge, and the fact that this anti-vaccination advocates are using social media to promote this, to promote anti-vaccination, I think it's really problematic. I think for me the question is, how did we get to this point where we have measles? I mean, this is something that I remember when I was in school, and that was a long time ago, everybody was getting measles. And I remember when I got to about class 6, I thought that measles was actually cured. And it seems like it has come back again. To me, I feel that this is a breakdown of our health system. Right? It's not just about the misinformation, but the question also has to be what's happening to our health system that children are not getting vaccinated the way they used to get vaccinated 30 years ago. What has happened to this vaccination program?
All right, and Manu, what do you think? I mean, everywhere we've gone, we see fear here in Fiji that the epidemic that started in Samoa could spread, that is already spreading in Fiji, and questions about the safety of children.
So addressing any challenges that's faced by the public health system is key, and also awareness raising and education programs would be critical to addressing this challenge. And yes, even in Solomon Islands, there's concerns there about the measles outbreak reaching our shores. So it goes back to working together to tackle this challenge.
Alex Hawke, is there something Australia could do, because there seems to be a huge missing or a gap in the amount of vaccine available?
Yeah, no, thanks, Tony, and thanks for the question. And I had an update. We have an Australian team that's in Samoa that went straight there on the request of the government with eight beds to help, and we've had more than 50 people die now. Most of those are babies, very small babies, so it's a very serious issue. Australia spends a lot of money propping up and investing in funds like the Global Fund and Gavi, serious people that do a lot of vaccinations for children. But vaccination rates are too low across the Pacific. Sometimes in Australia they remain low as well. In many of our states we work very hard on this, but we make vaccines available to the Pacific as well. And there's no doubt we've got more to do. But in Australia, for example, we also had to take on anti-vaxxers in our own country, and we did that through our welfare system. And you wouldn't be able to access government payments or in childcare, for example, if your children were unvaccinated. We had to take some very serious measures that we'd never contemplated before, and that still met resistance, that people wanted to send their children into childcare facilities unvaccinated. And so we all have to work together in changing attitudes on this to make sure when 50 small babies have died in Samoa, it is a tragedy. There is a lot to do in this space, and we'll be here to help.
Yeah, Ayaz, it has a sense of 50 babies dying, says national crisis. The fear in Fiji is there's not enough vaccine to go around. Is it true or not true?
No, we have an interesting history with measles. Back in about 1875, one of the chiefs went off to Sydney, and he came back and went to a chiefly meeting, where 69 chiefs were infected, and we lost approximately, the figures are from 25,000 to 40,000 Fijians actually lost their lives at that point in time, around about 1875 or so. So we have interesting history. We started vaccinations for measles around about in 1982, where it became compulsory in schools. I think maybe that's when Virasila was in school. And then, of course, we started this program. This time around, it's been picked up from New Zealand. I understand with somebody visiting from Samoa, then went across to Samoa. We have some new stocks that's arrived. We have a very robust vaccination system, and again, I think it's also attitude of parents too. People need to take a lot of responsibility to get their children vaccinated at a very early age. But we've had an outbreak in one of the provinces here in Serua Namosi, about 11 people, and 2 from the Suva area and 2 from Rio area. But definitely we've a huge vaccination. We've already had about 100,000 people have already been vaccinated. We've got another program, in particular in the Central Division, to roll it out. But again, we ask parents to take responsibility for it, make sure that the children actually get vaccinated.